Our scientists can date back to our country, and not only our country, but the world has gone through several dangerous diseases and viruses, from the tuberculosis outbreak of 1882 to the COVID-19 outbreak of 2020. There are endless statistics and information to learn about all of them. These are only a few of the hundreds of different illnesses that have made their mark in history. COVID-19. Right now, the nation is battling the terrifying and devastating COVID-19. Ever since the first case was reported on January 20th, 2020, our country has been in a nonstop state of panic. There have been so many restrictions and rules set in place, such as social distancing, wearing masks, and staying home unless it is absolutely necessary. Some of these restrictions have caused a lot of controversy and people who feel that they are unfair, so they fight back. For example, people who own small businesses are not happy because they feel that if big businesses like Walmart and Target should be allowed to stay open, they should be too. Now it has been about 9 months since COVID-19 started, and most people have gotten more used to all the rules. But now there is word of a vaccine that is starting to come along. Lots of people are in such a rush to get the vaccine that some people are worried that it will be too rushed to make sure it is safe and won't harm anyone. Many years before COVID hit, in 2003, a disease called SARS quickly spread across the world. SARS stands for Severe Acute Respiratory Syndrome. The first case of SARS was found in 2003 in China. SARS is a very dangerous and often fatal disease. Also, very contagious and can be caught very easily through actions like coughing, sneezing, and even just having a conversation with someone in a close proximity to you who is carrying the illness. SARS is very easily caught, especially by people from the ages of 25 to 60. And although this may surprise you, the majority of the cases reported were from previously healthy adults. This goes to show that whether you have a very healthy lifestyle or a very unhealthy one, you are never truly immune to a disease. The symptoms of this disease that were reported by the people that caught it was a dry cough, a sore throat, headaches, shortness of breath, loss of appetite, confusion, and fever over 100.4 degrees. While there are not many treatments and an official vaccine was never created, just the supportive care that was given to SARS patients did a very big part in resolving this illness and helping patients get over the disease. While there are many diseases and illnesses that had a big outbreak and then eventually when treatments were created, they would fade away and no one would really talk about them again, there are also illnesses that are very long-lasting. These illnesses can be very dangerous. One of these illnesses is heart disease. Although heart disease was not an illness that suddenly struck them, it is something that had been a constant battle for thousands of people around the world. Lots of people did not start to suffer from heart disease until 1960. As time went on, more and more people started having heart disease until now, when it's fairly common for someone especially of older age to have heart disease. There are many different kinds of heart disease, some being coronary artery disease, arrhythmia, and congestive heart failure. Most of the different kinds of heart diseases are fatal, the most deadly being coronary artery disease. Although there are many different kinds of heart diseases, most of them have similar symptoms. These symptoms include shortness of breath, chest pain, fatigue, and fever. The only treatment for heart disease is to have surgery in hopes of being able to help you get better, but it is still not guaranteed. One way to find out if you have heart disease is with an electrocardiogram, an ECG. An ECG takes electric signal from your heart that helps the doctor see if there are any irregularities in your heart. Another way to find out if you have heart disease is by a stress test. This is when you either use exercise or medicine to make your heart rate speed up, and then the doctor can see how your heart responds. This will also be able to show the doctor if everything is okay. There are also risk factors for heart disease, one of the main being obesity. At any time, approximately 48 people in America have some kind of heart disease. Another illness that took over the country during the time of its outbreak was influenza, also known as the Spanish flu. This lasted from February of 1918 to April of 1920, infecting over 500 million people. This virus was classified the most severe pandemic in recent history. The Spanish flu killed about 50 million people across the world, and about 700,000 of deaths were in America. The Spanish flu is a very serious illness that usually ended in death, partly because they did not always have the right supplies to treat the patients. During the time that this illness was at its peak, they did not have the vaccines or the drugs that would end this illness, also part of the reason there were so many deaths. The symptoms of the Spanish flu were very similar to the symptoms of the regular flu that lots of people in the world get every year. These symptoms include a fever, chills, and fatigue. This virus attacked the respiratory system and was very contagious. Anybody nearby could get this virus when somebody sneezed or talked. During this pandemic, to try to avoid overcrowding the subways, the New York City Health Commissioner tried to slow the transmission of the flu by ordering business close on staggered shifts. As you can see, the virus got so severe that people realized that they were going to have to take precautions if they wanted it to get better. Lastly, there was a disease called tuberculosis. Tuberculosis was first discovered by Dr. Robert Koch on March 24, 1882. Soon after this disease started spreading, it killed 1 out of every 7 people living in America and Europe at the time. Tuberculosis is a serious bacterial infectious disease. The symptoms for tuberculosis are slightly different from several of the other illnesses discovered in this time period. Some of the symptoms were weight loss, night sweats, and fever. Treatment for tuberculosis was not always necessary for those with a minor case of the virus, but for those who had a more severe case of the virus, they would most likely be treated with a series of antibiotics. Although it is not common to be used in America, there is a vaccine for tuberculosis. The vaccine is called Bacillus calmette-guerin, BCG. While it is not very common, people can still get tuberculosis now. Overall, after looking deeper into the effects of these diseases, we can see how things have changed since the late 1800s. We can also see how things have stayed the same. Most of these illnesses actually have very similar symptoms, effects, and even treatments, which is unexpected because it would make sense that as technology evolved, we would have created new ways to treat these diseases, and not only these specific diseases, but also other illnesses. But we almost haven't changed anything. This goes to show that even as the years pass by and illnesses change, they are really not as different as they seem.